Hi, my name is Emma. I'm an osteopath at Osteomed Practice of Osteopathy. The following exercise is to be done under the recommendation of your healthcare practitioner and/or trainer. If the exercise gives you any problems or aggravates any problems you already have, or if any good pain turns to bad pain, then stop immediately and contact your healthcare practitioner. So the following are a few exercises that you can do when you have low back pain. These are very subtle, very gentle exercises that actually, if you're in good condition in your low back, it won't really have much benefit. This is quite specifically if you are more acute, inflammation, hernia, any other low back injury that you might have, but specifically being in that acute phase. So for this, you want to be on your back as well. We're going to have 3 different exercises. The first one is going to be a unilateral leg exercise. And for this one, you're going to bring the knee up, hands around the knee, and that should allow, if you're holding with those hands, your leg should be completely relaxed. When you increase the stretch, if you can already feel a pull or a stretch into that hip, into that lower back or down the leg, it's not so important where you feel the stretch. If you can already feel it, then hold it. To increase that stretch, you want to bring the knee up towards the opposite shoulder, actually. This is quite important because you actually want to be bringing, when you're doing a stretch, you're trying to bring 2 points further apart. So, knee up, fix it with with the hands, and then increase by slowly bringing it to the opposite shoulder. When you feel that point of tension, hold, wait for it to relax, and do that 3-point rule that we always talk about. Increase when you feel it relax, and do that 3 times. This is the first one. You want to be doing that on both sides. So again, I'm just going to point out, it doesn't matter where you feel the stretch. If you feel it here, into the leg or the lower back. But hold that position, wait for it to relax. The next one is with 2 knees up. So you bring both hands around the knees, relax those legs. And again, they should be completely relaxed. The effort comes from the hands. And bring the knees up. With this one, you're more likely to feel the pull into the lower back. If you have a bit of tightening into this anterior hip, into the front of the hip, you might want to do a technique to release that first. But knees up, bring them towards your chest, and at the same time, flatten into the lower back. Do the 3-point rule on this one as well. The other stretch that we do, or exercise in this case, that we do for acute low back problems is tilting the pelvis. There is another video that we have to teach you that movement of how to do that posterior pelvic tilt, and I'm just going to show you quickly now. You want to be bringing the abdominal muscles down into the couch, and then you hold for a moment and relax. And then bring down into the couch, hold for a few moments and relax. You want to repeat that 5 times. I would suggest that actually you start with this pelvis movement, this abdominal exercise, before you do the other stretches. So the final exercise is again with your knees up. For this one, you want to gently rock your knees side to side. In this way, you're creating a little bit of movement into that lumbar spine. The amount of rocking that you need to do is very small, 5 centimeters maximum. If you start rocking into bigger sideways motion, this is going to go up into the thoracic spine, into the upper part of the back. So you're going to have your knees together and literally just rock side to side. You should be able to feel a little bit of movement. If you want, you can test it by feeling into that lower back. If you start feeling the movement going above your hands, then you're going too much sideways. And this one you want to do for 10-20 seconds. And that's it.